My name is Dr. Gift Sten Chinomba. I'm coming from Malawi. I'm a medical doctor by profession, and I work under the Ministry of Health in Chilazu district as a senior medical officer. So I was recommended to come here by the office of the First Lady in our country, Malawi. In our country, in terms of embryology services, in Malawi currently the service is not available to the public because we do not have IVF centers established. We also do not have practicing embryologists. So for that reason, we are like the first batch to be trained and constitute the first pioneers that will need to set up the IVF services in the country. So as of now, in terms of embryologists, we don't have in the country. In terms of IVF centers, we don't have in the country. Currently, those clients that are diagnosed to have infertility are not able to access scientific treatment options, as in assisted reproductive therapy. Rather, they would access similar services from nearby countries. Others do go to Zambia because Zambia has a set IRT centers, and others go elsewhere. But those that are not able to manage that, it means they go for other non-scientific treatment options. So these will include traditional methods, would include prayers and all sorts of things that people use as treatment options. Otherwise, currently there are no scientific methods of treatment being offered locally in the country. In terms of infertility in the society, usually it is regarded as a problem for the woman in a family. So if a family the woman is unable to get pregnant, usually society looks at the woman as being the one who has got the fault. This has led to a lot of stigma, especially among those women that have never been able to bear a child, or those that maybe have ever been able but are no longer able to bear a child. People have associated a lot of things with these type of women. Partly, others would think maybe during their younghood they had a lot of promiscuous activities, like a lot of miscarriages, or others think that there's something wrong that they did and it's becoming as a punishment. So mostly it's regarded as an issue for the women, and many are usually out. As a consequence, you find that there are a lot of women lose their marriages. There is high divorce rate, or at times you find that the man would go and find another woman. That is like a polygamous setup, or at times they may just have other extramarital relationships just because the wife is unable to get pregnant. And usually the women don't have much power to stop that, especially in the event that they are not able to get pregnant. In terms of level of awareness of male infertility, it is very low because, as I had said prior, that it is believed to be a problem for the women. It's on rare occasions that people would agree, would acknowledge that it is the man that has got the problem. So people don't believe that a man could be the reason why a couple is unable to have children. It's on rare occasions that people will acknowledge that. And mostly it's even maybe after attempting a number of attempts, maybe with different people, that's when maybe they would think it's the man. So mostly men are considered. The embryology training that Merck Foundation has supported me is very important to me as an individual, because it has led me to acquire skills and knowledge that are there in my country and will make a difference in a lot of people. At the patient's level, it will diversify the options for infertility treatment, because before, people never used to have these options available, but then the scientific treatment options will be available for people to use. So it will diversify the options. In the country as a whole, it will also increase access to modern methods of treatment, of treating infertility, which other parts of the world are also utilizing. So I feel Merck Foundation has done a great job, and it is my hope that it will make a huge difference in terms of management of infertility in my country. My expectation when coming to undergo through this course was to get adequate knowledge, adequate skills in terms of provision of assisted reproductive therapy services. And throughout the 3 months, we have gone through an intensive training, and I'm happy that I have attained those skills that I need to provide the services in our country. My advice for the aspiring candidates for the program is that embryology is still a new area in most of the countries. There's a lot of potential for them. If they study embryology, they should definitely be assured that wherever they will go, they will make a big difference, because infertility cases are very high than we expect. Most people don't come out because they're afraid of so many factors from the society, but they should be assured that their presence will make a huge difference in people's lives. It will save a lot of marriages. It will bring back that confidence in a lot of people. So those that are thinking of doing embryology, I feel it's a very good area to practice, and the rewards are just so many. They'll be very satisfactory. My plan is that after this training, when we go back to our country, since the biggest challenge is the non-availability of the services, we want to be the pioneers to set up an IVF center that Malawians should be able to access. There are a number of things that we need, including the policy itself. It has to be allowing, so we intend to move in an organized way to move towards starting this service in our country. I would like to thank Merck Foundation for this lifetime opportunity, supporting us, the three of us from my country. It is a program that we never thought we would do. And after coming here, it was an eye-opener in so many areas. So I would like to thank Merck. We think this is going to be the beginning of a new set of services in our country. Malawi